In this video, I'm going to show you some of my top exercises to deal with the frozen shoulder. You'll need a set of light dumbbells and a yoga block. Come join me. Hi, my name is Lauren Irk, and I want to welcome you to Fitness Integrated Science TV. In today's video, I'm going to be talking about the frozen shoulder. I've dealt with these so many times in my practice, and I have to say I'm not super impressed a lot of times with some of the ways that people are told to deal with this. So I'm going to show you my top 7 exercises that I like to give my clients, and we're going to do this in a very short amount of time. One thing to be mindful about in a frozen shoulder is not all frozen shoulders play the same. I've seen people where they can't even move their arm this far from their body, and I've seen other people where they're at least able to get it up to somewhat shoulder height. Not knowing what's going on with you, it's kind of hard to know where you are, so I'm just going to be giving a lot of different cues so that you can modify the exercises. Please feel free to give me any kind of feedback or questions down in the descriptions aspect of the video. I'm happy to answer anything that you might have, or leave it in the private Facebook group that we have for the channel. All right, so I want to begin by coming down onto your back. As you come down into your back, this is going to give you a really nice amount of feedback because the floor is just a flat surface. So we want to work on 2 different motions that we begin with, and this is called retraction and protraction. Now, I really focus on keeping everything below the shoulder in this video because a lot of times when you have a frozen shoulder, bringing your arm overhead is like the last thing you want to worry about. So as we take the shoulders up, I want you to feel, first of all, are you able to bring your arms over your head? This would be one way to do this at 90 degrees. But let's say that's not an option. You could even just bring your arms to your side with your elbows either flexed or extended. And all I want you to do right now is work on pushing the outsides of your shoulders down into the floor. Now, if you notice, my shoulder blades kind of move back and in, and you feel my shoulders became more flush with the ground. We're going to hold this here for a couple of seconds. Remember that isometric will give you that carryover effect, and then relax. And the carryover effect will actually help you to improve the range of motion above and below the position we train. So now let's roll your shoulders off the floor. So if I had my hands on the ground, do you see what I'm doing? I'm actually moving my shoulders off the floor. Now, if you're able to get your arms off the ground to here, if this is comfortable enough for you, then you can actually lift your shoulders up this way, and now we're actually dealing with the load of the arms. Otherwise, leave your arms at your sides. So retraction would look something like this again as I squeeze those shoulder blades into the back, or down here it would look like this. Then protraction would be this, so we're holding this up. Getting motion around this first joint, which is called the sternoclavicular joint, one more time, squeezing it back. That's the joint where the end of your collarbone comes into contact with your sternum. That's going to be the first place we start to work with in the shoulder. Again, roll your shoulders off the ground, coming into protraction. Then inhale, squeeze your shoulders back into the floor, coming into retraction. That's exercise 1. So as we come up into sitting now, exercise number 2, we're just going to use gravity as a tool. Come into a comfortable sitting position, whether that's on the ground or sitting in the floor, and I want you to just elevate your shoulders up into your ears. Now, most people can do this even with the frozen shoulder. This is called elevation, and again, we're still working at this joint. Then as we exhale, I want to push the shoulders down. If you can, once you push the shoulders down, actually push your arms into the ground. That will facilitate a lot of the muscles on the sides of the rib cage that do that as well. Again, rolling those shoulders up to the ceiling, and then pushing your shoulders down. So that's elevation, depression of the shoulders. Move your arms into the floor. One more time, roll them back up, elevation, using the force of gravity, then pushing them down the floor and hold. Now, my third exercise is spinal mobility. Spinal mobility is literally that, you moving your spine. Coming into cross-legged, sitting in a chair, whatever, let's take our hands at our shoulders and rotate to the right. This is spinal rotation. Take your hands to the floor and engage those muscles. Good, then as we come back to the center, let's do the same thing going in the other direction, pressing your hands into the ground. Moving the spine, strengthening the muscles around the trunk and spine will help to create a more stable scapula, which will be the first step towards you resolving your frozen shoulder. Now drop the arms down and let's come into side bend. So we draw ribs to hips, holding, and come back to the center, and then do the same thing on the other side, drawing ribs to hips, tightening into the waist, and back in the center. You can see that I'm actually holding this for a period of time. Now, lift up the sternum. If you can lift your elbows, great. If not, then just leave your arms down and then raise your sternum up. So you're feeling muscles engaging in the upper back. A lot of times the shoulders become tight because trunk muscles have stopped being used. Then again, we round forward, tightening into the abdomen, but also squeezing into the abdominal muscles. Then we bring that right back into the center. Now let's try another one that I call internal external rotation. We need a block for this one, so let's bend our elbows down to the side at 90 degrees. Then I want you to abduct the shoulder as far as you can go. If you're here, this is where you go. If you're way up here, this is where you are. I'm going to show you my maximal range, but I want you to work within your maximal range. Now, once you're here, make sure the back of your shoulder is on the ground. And then I want you to let the back of your hand fall to the floor. So what I'm going to do is I'm going to position the block to where it blocks my hand. As I push back into that block, I'm feeling muscles engaging across my rotator cuff. Hold that for just a few more seconds, and then bring that right back up. Let's try that one more time. Inhale, breathing. Rotate that shoulder outward so that the forearm can drop down into the block. Remember, when you have frozen shoulder, there's a lot of times a lot of muscle weakness associated with that. So like always, when we're doing these exercises, we want to push very lightly. Don't use too much force, and try not to incorporate other body parts to do the motion. Focus right now on squeezing muscles at the shoulder. And bringing that up. Now, we want to do the same thing with internal rotation. So what I'm going to do now is take my shoulder and internally rotate it. I don't have as much on this side, so I'm just going to take my yoga block, place it right, underneath my wrist. Then when I push down into my internal rotation position, actually feel that resistance moving across really it's right in through here at the back of the shoulder. Then I bring that right back up to neutral again. And every so often, make sure that you haven't fallen out of abduction. Keep that arm at the same distance to the side. And again, as we come forward. Now, what you may notice as you go through these isometrics is that you actually gain more range as you go. I'm just very lightly touching the block. If you feel like you're shaking or cramping, it is way too much. And when you have a frozen shoulder, that happens quick, right? Can't snap today. But anyway, push down into that block and hold it, breathing lightly. No cramping, very light, and release it. So let's just change sides. I'll flip around so that I can instruct you again. So I'm bringing my arm directly out to the side again, 90 degrees, making sure the back of my shoulder is on the ground. Then from there, I'm abducting. And I don't have as much on this side. So because of that, I'm going to allow for that. Now as I externally rotate, I'm not going to have as much here either, so I'm just going to bring that block down to where my arm can push into it. Now if a block doesn't work for you, a pillow or something like that a lot of times will be just fine. Or a couple of books, I've used that before at home, and then back in the middle. So again, make sure you're not arching your back and cramping just to try to get in these positions. It's always better to do just a little less. So I'm just very lightly, it's almost like I'm just touching the block. I'm not even really pushing into it. I'm just touching it until I can get a sensation in the back of my shoulder. And then one more time, inhale, breathing, pulling back and holding. Feels very therapeutic. I feel like I'm waking my arm up, not trying to exhaust anything. Now, my internal rotation on this side is much less. So this is the hardest position for me ever. So I'm going to make sure that my yoga block, I may actually hold it with this arm if I need to, just to kind of bring it in place. Then as I push down into it, I'm going to be super light with that just to accommodate my shoulder. I think I've told you guys I separated my shoulder at age 13. So my clavicle is unattached on this side. So I have to be careful whenever I'm exercising. I've never had surgery or anything like that, but I've just done a really good job of keeping my shoulder strong throughout all the years. I've never stopped weight training since age 13 on, and I've taken yoga for 40 years. So I think that's really, really key, especially when you have joint issues. And once you've had a frozen shoulder, you got to remember that shoulder is probably going to be compromised forever. You're going to have to work on, once you resolve the frozen shoulder, that encapsulitis of the shoulder, you're going to have to work hard to keep those shoulder muscles strong throughout your life. All right. So let's go ahead and release that now. And I'm going to switch now to a light pair of dumbbells. This is my next exercise. This is abduction. So as I come to my side, I'm going to start with my arm just very lightly off the body. So let's say this is as far as I move. That's completely fine. Just use your own body weight. If you want to do a dumbbell, I would say a pair of 2s, 3s, or 5s max. Somewhere where you can actually hold that position, balancing, and then come down. Now I internally rotate just like I did. So my pinky finger is up, and then I bring it up again and hold it for about 5 seconds, breathing. And then back down, and then I spin it back to the center, rotate my thumb up, so now I'm externally rotated, and hold. And you can do these as many times as you like. I'm just going to keep it short and sweet for the length of the video. I want this to be only 15 minutes. And release it and come down. All right, let's come back one more time in the center just to make sure we have an even number 4. And release it. So now let's switch sides as I come through. You can just turn over on the other side, but I'm going to flip over. We start from the center. So here I am in neutral. I'm just barely lifting my arm. We definitely discount this. We're always so worried about how do we get our arm over our head so quickly with the frozen shoulder. Honestly, if you just train these lower positions, you will over time get more range. Training way down here will open up range at least 30 degrees above this position so that you may be able to do some things from a standing position. Now internally rotate, I think I did these in a little different order. Thumb down, and again, I'm going to be weaker here because I don't have as much, but this feels so good on my shoulder. I'm actually able to hold this. I'm not shaking, I'm not cramping. And back down, and then one more time in the middle again. I'm just pulling up through the dumbbell and hold. Notice how I'm just training this very close to my body, making sure that I don't have a lot of different movements of bones on each other. You know, when we bring our arm up, we have to move our clavicle, our shoulder blade, and our arm bone, plus our spine has to move. So the more joints we bring into play, the more complex the exercise. Therefore, when we're trying to rehab a frozen shoulder, keep it simple, stupid, right? Keep it simple. Keep it right by your side. So now let's take both of our dumbbells for an exercise number 6, which is retraction. I've done this in many videos. First of all, you coming up into extension is going to do so much to help your shoulder because that's going to build strength in the upper thoracic spine. Then as I slide my hands under the dumbbells, we're leaving them on the floor, pull up gently. So we're feeling that light activation in the shoulders. Then from there, I want you to pinch your shoulder blades together. Retraction of the shoulders, so important. Hold. Then come down. Now releasing that, move your arms up to the ceiling by themselves. Notice how far they go. This is shoulder extension. And then relax. One more time, slide those fingers underneath, pull up gently through the dumbbells, squeeze those shoulder blades together. And if you want to add a backward bend, fine, or you can stay on the ground. But right now the hands stay on the ground. I'm just moving the shoulders. And you will feel this tremendously all across the middle back. You really want to feel activity, neural activity between your shoulder blades. If you don't, back off the force, back off the position until you do. These take practice. Don't think that it's going to happen overnight. Now raise the hands off the floor. See if they feel any better to you. Try to keep your elbows from bending. And release it. For my final exercise, number 7, it's going to be protraction. So, starting off, take your block and press it against you. So we have some sort of an object that we're holding that we can actually push against that's not our hands. Then from here, see if you can now move the block away from you and then lightly push. Notice that your shoulders are rolling off of your back. And then release it. Now let's take this shoulder as high as you can go, bring it across as far as you can, set the block in place, and push this hand into the block. So my back hand is just there for holding the block up. And I could drop this down if I don't have a lot of shoulder flexion, or I could train it right up here if I like. and back down. Then I do the same thing on the other side. This is as far as I'm moving on this side. So I'm placing the block here. My other hand is there to hold it there. And I'm pushing my top hand into the block, feeling tension all across the inside of the shoulder. Now these can be done from a seated position in a chair or from standing, and then relax. Final exercise as we push in, the same exercise. See how far you are capable of bringing your arms over your head on your own, not with a stick in your hand, not with a ball rolling up a wall, you raising your arms. And I don't care if you're way down here or if you're way up here. This is as far as I'm going to go today. I want you to very lightly push into your block, lift up through your chest and hold it. And come back down. The more you do the work and not some outside thing, the more quickly you're going to resolve this. And really, it's not about being quick. It's mainly about being smart. I already have more range right here. I'm pushing into my block, trying to maintain the upright position, and releasing it back down. Last time, my protraction exercises, I'm here. Woo, I'm getting even more. I don't know if you can see this on camera. I'm not faking this. I'm getting more every single time that I push into this. And release it. Now, when you finish this video, roll your shoulders around and notice, do you feel any more energized? If you get done and you have discomfort, you know you're pushing too hard, come back to it next time and use less force, listen to the cues, work on these positions, and I promise you this will be on the road to recovery. Thank you so much for watching. I'll see you on the next video.